Assalamu alaikum. Our today's topic is going to be bronchitis. Bronchitis is the inflammation of the bronchi. So, there are two types of bronchitis. One is acute bronchitis, and another one is chronic bronchitis. So, what is acute bronchitis? Acute bronchitis is generally chest cold. That is the common cold that one gets is usually acute bronchitis. It just lasts for less than a week. But when it comes to chronic bronchitis, there is a definition, that is, it is clinically persistent cough with sputum produced for at least 3 months in at least 2 consecutive years. That is, in 2 continuous years the patient is going to cough for 3 continuous months. So if, for example, if you take 2021, in 2021 the patient should have coughed for at least 3 continuous months. He must have had coughing with sputum. And again in 2022 he has minimum amount of 3 months he coughs continuously with expectoration. So that is chronic bronchitis. So what is the clinical features of acute bronchitis? There is going to be wheezing, sore throat, like everything that you get in common cold. Sore throat, there's going to be congestion, there's going to be chest pain, fever, fatigue, and anorexia. When it comes to chronic bronchitis, there is going to be cough with sputum expectoration, there is going to be fever and chills, there is going to be cyanosis because your oxygen transport is compromised, and therefore it can lead to cyanosis, and it will also lead to shortness of breath, and it will also lead to fatigue. So these are the clinical features. Next we have causes. So the causes can be viral infection, which is most common. So the viral infection is like rhinovirus, parainfluenza virus, coronavirus. These all can cause bronchitis. Bacterial infections such as Bordetella pertussis, chlamydia infection can also cause bronchitis. And the inflammatory causes such as like smoking for a long period of time, it will definitely lead to bronchitis, that is the inflammation of the bronchi, and it will also lead to remodeling of the bronchi eventually. And then you have cystic fibrosis is a congenital, it is a genetic disease that a person, it is usually found in organs which have these mucus secretion. So cystic fibrosis. And then you also have allergens as a cause, so constant exposure to allergens like pollens or paint, it can be anything a patient is allergic to. And then pollutants, and then toxins, so these all can cause chronic bronchitis and bronchitis. The next one is treatment. So how, before treatment, how do we diagnose bronchitis? So after clinical examination, after listening to the patient's history, you are going to send him to a chest x-ray, and then you have to do a sputum examination to find if there is any type of microorganisms involved, and then you have to do a pulmonary function test and then pulse oximetry, and then you have to come to treatment. So treatment, what you do for treatment is you are going to give analgesics for the pain. If the patient is experiencing any sort of pain, you have to do symptomatic treatment with analgesics. You can give ibuprofen, analgesics like that, which do not compromise with pulmonary system. And then you have to do symptomatic treatment, and then you have to increase the fluids, antibiotics in case of bacterial infection, and then in case of infection you have to give antibiotics. You have to give bronchodilators because the bronchi are, there is going to be a lot of sputum secretion, therefore the bronchi, the lumen of the bronchi is going to be very reduced, and therefore there is not enough space for the air to pass. So you have to give bronchodilators, and then you have to give decongestants again to reduce the congestion, and then oxygen therapy in case of very reduced pulse oximetry results. So the complications are pneumonia and chronic obstructive pulmonary disease. So bronchitis can eventually lead to pneumonia and COPD.